And so I ran upstairs and I talked to Ben Truman, and I was like, hey, can we get a Facebook page? And he's like, no. I was like, what about Twitter or Instagram? And he's like, yeah, we'll have to talk about that. So fast forward about a year, and CDC then came here for a site visit. And I don't actually know what his title is, but the person who's in charge of the Wise Woman program was here. And I mean no offense by this, but he was on his iPhone pretty much the whole time. And, you know, we traveled around the state. We showed him what Vermont had to offer. We sat in a jazzercise class in Barre, Vermont. All the CDC folks in their suits and all the Vermonty women in their exercisey clothes. That was pretty sweet. And he was on his phone the whole time. And we were talking at the time about evaluation because the evaluation person had come as well. And we got into this conversation as we were driving around the state about evaluation reporting and about what that looks like. And I had this sort of aha moment about, do evaluation reports really have to be a written report? Couldn't we do it some other way? Could we do it visually? Couldn't we take all these resources that we have and present the data in just a different way and not have like a report that I had to sit down and write that got put on the shelf? So that is the whole impetus behind this project. And so I have to say a few other things. I need to say that Patrick Kinner got called for jury duty. And so I am going to be Patrick as well. I'll get taller, I'll talk a lot faster. And so I just want to actually, so I don't forget, I want to thank all of the people who worked on this. And there were a lot of people who worked on this. For sure, the Ladies First staff all around here. Nicole Lucas was in at the beginning. Sue Camp, Julie. Christy Valancourt is going to bring up the end and talk about how we turned the idea into a reality. And so just remember that for the Patrick-y parts, I'm kind of filling in at the last minute. You know, don't ask really super hard questions about that. Thank you. So, Patrick said I had to show this slide. Exactly, see? And tell you that this presentation hits two of these essential public health services, the one that talks about evaluate and one that informs, educates, and empowers. We are going to be so empowered by the end of this, you'll be bursting. A few quick items about Ladies First. So for those of you who don't know, I'm not going to read it. You can read that. But the important thing to know about Ladies First is that we operate as kind of a mini little community health team here. We offer direct service to women in Vermont. We talk to them on the phone. We interact with them in a lot of different ways. And what this evaluation looked at was to really assess how we were doing. We wanted to know. We talk to these women all the time. We offer them what used to be called case management services. So especially in the cancer world, if a woman gets an abnormal diagnosis, our staff call her up, talk to her, help her find whatever appropriate treatment she needs, help get insurance at times. We really operate in this sphere that's a little bit different for the rest of HIP-DIP. And so it's important, you will see later. So, and then in the heart health world, we do health coaching. We talk to women on the phone. We get them into exercise. We try to engage them in the program. So that's what you need to know. So now Patrick. Okay. So at the end of the day, this is what we ended up with. We call this campaign Real Stories from Ladies First. So part of this was that, as with every program that's funded by CDC, needed to do evaluation. Ladies First is two different CDC programs, a cancer program and a heart disease program, and so we have to evaluate all of it. What we did in this evaluation was to combine the evaluations to see if we could get a better picture overall of the people that we serve. So these were the questions that we chose to ask. On our health side, CD is very prescriptive about what evaluations we have to do, and on the cancer side, we got to pick, and so that's how we ended up with these questions. And the purpose of the evaluation, as I said, was to figure out how were we doing. It was really sort of a customer satisfaction survey, and we really wanted to know. So the two things you need to know about the specifics of the evaluation is that we evaluated on the cancer side what we call patient navigation, so that case management, that helping women with a cancer or abnormal diagnosis through their treatment. And on the Wise Woman side, on the heart health side, we work with DCF, and we actually buy these farm-to-family coupons that allow people to go to farmers markets and spend money. And, so we partner with, over here. Partner with DCF, and we give our heart health members coupons to go to farmers markets. And so this evaluation is looking at both of those things. So, again, being Patrick, what I'd like to point out here is that the first 4 questions are strictly qualitative. We gathered opinions and perceptions about the program and about how we were perceived, and the last question really was the only quantitative, and with our internal data to figure that out. So methodology, There we go. So the methodology that we used for the patient navigation part, we ended up being able to interview 12 women who had received these navigation services in this time frame, which meant that they had at least 3 contacts with our staff during that time. Of the 12, 6 of them completed the interviews. And so for the farm-to-family portion, we had 36 women who received the coupons during that summer of 2014. We had intended to break the coupon users out into 3 groups, those who never used their coupons, those who only used a few, and those who used all of them. But it turns out that our numbers were actually low enough that we couldn't do that, so we ended up lumping them all into the 13 completed interviews that we were able to do. And I'd like to, at this point, say thank you to Jen Hicks and Shayla Livingston, now they're one person, because they helped us with the interview portion. And another little Patrick-y thing, so the AHS-IRB deemed that this project was purely evaluation, and therefore approval from them was not determined to be necessary. And I'm not going to read this, but the women could also consent to different parts of how they allow us to use their data or their image or their quotes. So we interviewed these women, and we transcribed every interview, and some of the women we asked if we could take their photograph in addition. There's a bit of demographics about the people that we talked to and about all of Ladies First. And if you note, the sort of interesting thing here is that the patient navigation women, 16% of them had other health insurance. What you need to remember is that at this point, for sure, that Ladies First was primarily a program for women who did not have health insurance. We were allowed to co-enroll women who had health insurance and pay their deductibles and pay towards their copays, but in general, at this point in time, the number makes perfect sense because we are a program primarily for the uninsured. going to show you what the evaluation questions were, and the three that are highlighted in red are the important ones. Here are some key findings on the patient navigation side. Again, these are the women with an abnormal diagnosis who are navigated through their care. So their common barriers were, how do they pay for services? They often have billing questions. And a big piece of what we do is helping them coordinate the medical services that they need. So interviewees consistently reported addressing these barriers. They generally had very positive things to say about their patient navigation experience. And their recommendations were across the board that Ladies First should advertise more, that we should get the word out, that they would help us get the word out because they were so empowered and impassioned by the excellent care that they got from our staff. It's true on the farm-to-family side. Women consistently said that $30 in coupons was great, and we have actually the best quotes from these women that we surveyed about how I never saw kale before, and now I cook it all the time, or those funny big red things were beets, who knew those were sweet? The other thing they said was they would like to have more than $30. They would love to have this service in the winter, perhaps. And in that sort of PDSA cycle world, we took all this information to heart, and we actually now provide women with winter CSA shares. We've been partnering with the physical activity and nutrition folks to give women coupons in the Rutland area for fruits and vegetables in a local grocery store down there. So we took this advice to heart. Now, Christy is going to talk about how we took that data and formed it into something magic.
Overwhelmed. Off to a good start, guys. Good? Okay. Hi, everybody. Good morning. Thanks for joining us. I'm Christy Valancourt. I'm the Communications Media Coordinator for HipDip. So we have all this great, oh God, hold on, doing it. I don't love the sounds coming out of the computers. Okay, now the so what. So what do we do with all this great and rich data that we got that would make people care and not leave it on a shelf to get dusty? Don't worry, that's just me. Ding, ding. So who in the room is familiar with Humans of New York? Nice, lots of people. Okay, so for those who aren't familiar, it's a blog that features portraits and captions from real-life New Yorkers just telling their story. And it's incredibly inspiring and really draws the audience in and has just become this viral phenomenon. So for those of you who are familiar with Humans of New York, this might look a little similar because we were absolutely inspired by that. That's not working. It's not advanced. Oh, gee. I use the arrows. Okay, so anyway. So why narratives? Well, no, it's not working. What I think is different. See, it just saved itself for me when it was my time to present. Okay. Oh, again, that's why Christina makes the big bucks. All right, so why narratives? Well, they work, simply put. They invite the audience into another's world. They're more difficult to form a counter-argument. It's somebody's story. Also, they're compelling emotionally, and they're very persuasive, but not in an obvious way, in an implicit way. lots of different social media platforms to choose, and you may hear a myth that's being perpetuated that Facebook is dead. That is wrong. I'm here to debunk that now. For this audience, this is still king, Facebook. This is a recent study from Pew Research. And as you'll see, that the overwhelming majority of adult internet users are also on Facebook, and even higher for female adult internet users, and about the same for adults who live in a rural area. So there are people. If we were going to use a platform, this is the platform to use. So we had a couple of goals, as you'll remember, for this evaluative data. We wanted to use it now to increase awareness, but we also wanted to highlight the value. Ladies First is special. It's not just health insurance. It has a passionate membership. These women have amazing stories. They are ambassadors for the program. They are more than happy to tell others. They tell all of their friends. So we wanted to harness that good energy and use it to get new women to our program, as well as to celebrate the women who are already enrolled. 19 participants who were interviewed as part of the evaluative data side gave their permission to be a part of this second phase. And of those 19, 6 gave permission to have a professional photographer come to them and take portraits. All men who agreed to that were given those portraits as a thank you in the end, and you'll see them in a moment. They're quite beautiful. And what's called with evaluative data when you're trying to then transform it into something like this that's going to be a compelling story in 2 sentences is finding that compelling quote in the 2 sentences, right? For those of you who have done this kind of evaluation work and you look at the transcripts, there's a lot of, I think, I'm not sure. So some of it is how you ask the question, right, is the answer that you'll get. And some of it is we to tie the quotes together that had a consistent theme or topic to create what we call a composite quote, which really captures their story while still maintaining the authenticity of their voice. We were very lucky because we were able to contract with HMC. Many, I'm sure almost all of you in the room know them, and many of you have worked with them directly. So they had a professional photographer on staff. They also helped us come up with this little real stories from Ladies First look, the color scheme, all of that. I worked with them to get something that we really all felt good and comfortable with. So they also did all of our paid promotion. So again, we used Facebook, paid posts on Facebook. We did 3 posts a week. Each post ran for 2 weeks. In total, we did 13 posts during the campaign. So that was because of timing. We wanted to be done by the end of September. And some of it was we didn't want to oversaturate our audience. We wanted to just give them a taste and wait for more, give them another taste. So I think that worked really well. And the beauty of Facebook, the beauty of digital campaigns is how hyper-targeted we can get. We're not just blasting out to the universe and hoping somebody's listening. We are really specific with who we want to make sure we're talking to. So obviously we wanted to make sure we were talking to women who would likely be eligible to be enrolled in Ladies First. So for that reason, you'll see that we targeted our promotion on Facebook. So the primary audience was Vermont women of 40 years or older. The secondary audience was a little younger demographic, 21 to 39. Income $60,000 or less, and then less than a college degree. So further ado, here are a few of the posts. These are 3 of the professional photography. You can see that each one of these posts is unique, right? So it's not just somebody took a headshot, right? It's this photographer went to where these women were most comfortable, where they most felt themselves. The women got to determine what that would look like and where that would be for them. So this one woman, Melissa, is with her dog because that's a big part of her life. I don't expect you to be able to read this fine print. Don't worry, I will read to you. So I'm going to pull out Melissa specifically. So it says, in April of this year, I had gone for my mammogram and I was diagnosed with having breast cancer. I had gotten the results from the biopsy they did the same day my husband was unemployed and we lost our insurance. Ladies First was just wonderful to deal with. They're very helpful. They always call back. They're considerate. I couldn't ask for nicer women that I talked to there. They worked really hard to get and help me through such a difficult time period. I let people know that that's how great the organization is. So a couple of things stand out with this that I want to call your attention to. One, there's no call to action. There's no call Ladies First today at 1-800, right? That was intentional. That we felt like would actually take away from the power and the inspiration of Melissa's story. Also, remember, narratives are implicitly compelling and persuasive. So we wanted to let this be on its own. On our Facebook page, there are all sorts of direct links to our website, but we want it to live within this post. So that's one thing. The other thing I want to call out is we don't massage the language on this quote. This is Melissa's voice. So again, it doesn't sound too polished. We didn't want to sound like an advertising company. We wanted to sound like Melissa was sharing with other women. Here are other of the original photography posts. So there were more posts than this, but we just wanted to, for the purposes of time, to highlight the ones in which we did the original photography. So again, 3 new posts, totally different looks, but with a continuing theme, very authentic, I think quite beautiful. The women were very pleased to receive these portraits. So I'll call out Mary Rose. Mary Rose has been a member for Ladies First for some time. She says, I think the best experience I had when Ladies First came into my life during the loss of my husband. The insurance I had was cut off. I called Ladies First, and sure enough, I was told I can still get some benefits through them. So Ladies First was looking out for me. When I was worried about my gaining some weight, they got me into a good program to monitor my weight to get back on the right track. So that's Mary Rose. I love Mary Rose because she's using Ladies First in a variety of ways. This, for some women, could just be a point-in-time service. Seems more often than not, there are a lot of active members that continue on, and Ladies First becomes part of their family in a way. I mean, that speaks really well to the staff of Ladies First, too, and their incredible customer service. And this is very small, so don't worry, guys. It's story time. I'm going to read to you today. This was our highest performing post. Not one of the original photography that we did with this particular campaign, but it was original photography for Ladies First. It was an existing asset that they had done, I think, a couple of years before this campaign. So this was one of the standouts, and I'll tell you what those metrics look like in a moment. But one thing I love about this post is that women are supporting women. You know, I think there's a lot of negativity right out there in the world, and sometimes it's obvious in social media, and we see them as trolls or whatnot, and that we did not have that in this campaign, which was so incredibly exceptional considering, and once I tell you more of the metrics, how far that this campaign ended up going. But in some of these comments, it's, you go girl, and good for you. I know how hard it can be to start a transformation. I'm so glad this post came up on my page. I could use support and motivation. These are women who don't even know each other. They're seeing each other, and they're starting to have a dialogue not only with Ladies First directly, but with each other. That was the whole purpose, right? Okay, these are the metrics from that post. I'll tell you what this means, and I'll tell you why this is amazing. Over 16,000 people were reached. That means over 16,000 people had the potential to engage with this post in some way. It came up in their news feed as a promoted post or as a friend that had shared that post on their own page. So, that's a lot of people, obviously. 467 people reacted in some way to this post. That is incredible. You're lucky if you get 10 people reacting to your post. Okay, so that's the scale that we're talking. This is incredible. What's a reaction? Some of the thumbs up, liking, loving, laughing, wow, any of those. Those are all, that's a way of people directly engaging with your post. 20 comments, all positive. Again, phenomenal. 29 shares, I've literally never seen that on any campaign I've ever worked in. So that is the highest level of active engagement. That is somebody seeing a post. Keep in mind, this is a sponsored, paid post in their newsfeed, right? clicking on it, reading it, feeling so inspired by it that they're compelled to then share it on their own personal page. They're not being paid to do so. They're not getting any credit to do so. It's simply because they want their own personal network to see what has inspired them. That is nothing short of phenomenal, and that's why I think that we're so proud of this campaign, because it went so far beyond our expectations. And clicks, that's another way of engagement, right? You see it in your feed, you click on it, and you're doing it. All right, so, okay, so great. So people are on your page. So what does that mean? Well, for one thing, they were liking our page. So that means that our staff continues to post these really inspiring, empowerment and healthy lifestyle posts and information about Ladies First. All these new people who have subscribed to the page or liked the page, they're getting that information as well. So they're starting a relationship. They're dipping a toe in. Whether or not they're members yet, they're having a relationship with Ladies First. Also, our fans, sometimes you get a lot of likes, but then when you drill down, you're like, oh, okay, most of these people don't live in the country. They don't speak English, and these are people going around and just liking all sorts of pages. That's not happening here. So our fans are also our people that we're looking to bring into Ladies First, right? So 97% of them are women, great. 95% are from Vermont, all over the state. Most of them are between the ages of 35 and 64, and that's really Ladies First and butter. We service women that are younger too, but this is where most of our services can lie. Interestingly enough, maybe not so interesting for the people who do communications in the room, Megan, I'm looking at you, most likely to view the page from a mobile device versus a computer. So I do think, again, there's a myth of, oh, well, that's what younger people do, and that's just not true. We're all moving towards mobile. So the fact that Facebook is already optimized for mobile, great. Our website, also optimized for mobile, absolutely essential. You just cannot, it's just intolerable, I think, at this point to have a website that doesn't look good on a mobile device. We had a really drastic, I mean, this is crazy. It's hard to get your head around a number like 3,882% increase in engagement. I mean, that's huge. During our campaign, some of that can be explained by the fact that our Facebook page was pretty young. It was a baby. It had only just started, maybe 4 or 5 months before this campaign. So we had hopefully nowhere to go but up. So what's really incredible about this campaign and what we wanted to make sure we shared with you today is that you'll remember those posts had no clear call to action. They didn't say visit the website. They didn't say call member services today and get you signed up. But what's incredible about this, what was that? Okay, a little power surge, is that when we took that next step, saw a post, they clicked on it, okay, great, so what? Then they bought out Ladies First website. We saw an increase during the campaign. They're spending more time on our site, which means that they're hopefully reading, viewing more pages. Very interesting to note is a huge increase, 342%, a threefold increase in the percentage of people coming to our website, specifically going to the eligibility page. So they're curious. They want to know if this is something that would work for them. Most users, these new users, came from Facebook. So I think with some confidence, we can start to make that correlation that during this campaign, there was a connection to visiting our website. So I'm going to blow your mind, guys. Hold on to your seats. They lost. They took the third step, the biggest step. I mean, calling a 1-800 number when you don't know who's going to pick up and you've got some big questions or potentially maybe you're in a really scary time in your life, that's a big, big step. We saw a huge increase, 200% increase in calls year over year during the campaign versus the exact same time in 2015. That's incredible. I mean, that's what this is all about, right? That's why we do this work. The majority of them, like 77% of them were eligible or maybe eligible. So again, we're reaching the right women. The women who are calling us are women who are likely going to be able to become Ladies First members. And ultimately, 26 women became new members of Ladies First. Okay, good. Here, you can always turn around. I won't be upset. And one thing, so the membership, those are good numbers, but one thing that stood out in this cohort is that they had an above average active membership status. So it's like they didn't just fill out an application, send it in, they got their little card and they're using the services. They're going to the doctor, they're showing Ladies First cards, they're engaging with our lifestyle programs. That's what we want to see. Let me come up and give you some final conclusions and recommendations. Thanks.
No. So our final conclusions and recommendations. So from a tiny little bit of snarky self, like, oh, we could do this so much better, something really interesting and really cool. And the beauty is that for a small program, we're a pretty tiny program. Our total membership is somewhere in, Matt, tell me if I'm wrong, it's about 1,000-ish women. And so for us to be able to advertise, for many years we were not allowed to advertise per se. We weren't allowed to use our federal dollars to do anything but offer clinical services. So the past few years, CDC has kind of cracked that open a little bit, but we're not, like, we don't have a big ad budget. And so for $180 a post, we did, I don't know, 3 paid posts for 2 weeks, blah, 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 6 weeks.
$4,000.
About
that includes monitoring and reporting by the ad agency. Right.
Not a lot of money. And so for this end of this project, it is totally scalable. You know, it turns out that social media, really is a good way to reach people in a state like Vermont. So the other lesson that we learned that I think was more interesting, to me anyway, was that we took evaluation data, we made it sort of interesting and fun, and it's not a report that's being shelved, and I'm going to go present this at the Cancer Conference in August and at the Rural Health New England Conference in the fall. And so, you know, we sort of proved the point that you don't have to just write a report and have it sit there and do nothing. And as a program, for sure, we learned from the evaluation that we did. We've changed our practices. Through the other, you know, quotes and recommendations from our members, we met probably a lot of staff time was spent talking about, well, what did they say? What did these women say to us? And what are they looking for? Some of the other lessons learned on the techie side were we made a couple of mistakes. At first, HMC took all these transcripts and they sent us back these fabulous quotes. And we were like, okay, we can't do that. This is data. So HMC didn't quite get that this is data, that we're not allowed to just take those words and fancy them up and make them sound like not women. And so we quickly backpedaled and said, oh, okay. And that's how we came up with the composite quotes. So those composite quotes are their actual words. They might have all been right next to each other. But as a lesson of that, we went back to each woman and we made sure that she was okay with what we were saying, her face on Facebook. And again, for us, every time we talk to somebody, it really just helps us increase our membership, increase our bonds with those women. And so every opportunity to engage with somebody is a plus in our book. And so, pretty much, whoops. Yeah, okay. So that's what we got. I'm happy to take any questions. I'm really, again, thank you to so many people worked on this, and I'm very bummed for Patrick. He was really excited to worked hard on this. It was a lot of work, and I'm bummed for him that he's not here. So when you see him in the hall, give him a... And so if anybody has any questions, I'm happy to answer them. One question. Somebody's got to ask a question. Okay. How do you narrow down to people's income on Facebook? I guess that's a degree and that sort of thing. How does that work? You're not quite. Oh, that's what
mic is for.
Okay, I'm just wondering how on Facebook do you target people of a certain income?
So, okay. On book, when you're paying for the ads, you can say like interests and all sorts of things, including household income. And they're very clever on the internet. They know everything. Okay, just so you guys know, there's nothing private on the internet. Big Brother is indeed watching right now. Mm-hmm. So I don't know how, because Facebook, I don't think they ask you for your income level when you sign up because you're young. But there's a lot of ways to figure it out based on, it's probably all really intense algorithms that are all proprietary knowledge. But sometimes you're logged in on your Gmail account. Also, if you're logged in somewhere else, and also Facebook, sometimes those can talk to each other in that way, and probably what you're looking at buying based on, interests, and it makes you really deeply comfortable when you start to learn more, right? Scary stuff.
Anybody else? Well, yeah, go ahead.
I was wondering sort of what's next for you guys.
So we have continued using Facebook. Emmy Casper is our outreach coordinator. And so we engage women all the time. She just had one the other day. It was back and forth about, hey, what's this program? And we monitor the page. Evaluation-wise, we're done. This is the report. Now it goes on shelf. And so, but we continue, my hope would be that we could actually move on to Instagram, or some of the other, like, Snap stories would be fabulous for ladies first.
Your audience is not on Snap, my dear.
Whatever. The 21-year-olds are definitely on Snap.
21, yeah.
And so that's what's next. We're just going to continue. Okay.
I'm
Get out.
Insult me. We're not in Montana. So I was just wondering if you have a ballpark estimate of how many women in Vermont are eligible, and what proportion of those eligible women are actually receiving services, just like now.
I'm going to turf that over to our data manager, who might know off the top of his head rough numbers.
Yeah, I don't off the top of my head. We have about 1,000 members, and in Vermont we probably have, and I'm just thinking here, maybe 8,000 people that are eligible, maybe more.
So
I can get those numbers for you later.
Well, and I can clarify.
So it's actually like a pretty low percentage of women. Like, we could probably get a lot more women in the program.
Yeah, but let me clarify that when we started this, CDC only allowed us to enroll women who were uninsured or underinsured. And in the years since we started this, they've actually allowed us to expand our services to women who have Medicaid. So in fact, the pool is much bigger now. At that time, I think, from the ACA, there was about 6,000 women in Vermont who did not have health insurance. And so if you scale from that pool, that doesn't include women who are over 64 who we can't, and under 21. So
Yeah.
That's sort of where the numbers
One
are.
thing that's a challenge, I think I speak for, on behalf of Ladies First program here, is that with the rules changing, with ACA coming out, changing course like that, there is still of like, oh, okay, well, we don't need Ladies First anymore, right? Because that problem solved. Now now people may be not saying that anymore, but they have been. In fact, friends of mine that are doctors are like, oh yeah, I've heard of Ladies First. I thought that would have just gone away because it's not needed. So tough, right? Because the political landscape keeps changing, the health insurance landscape keeps changing, so the message of Ladies First is changing, and the way that it's still relevant is for follow-up tests, that insurance may not pay for, your deductible must meet first, or lifestyle programs like being able to have a free membership to Weight Watchers and a gym membership, and all these things that, that are on the prevention side that is invisible, right?
Right. Robin?
Presentation, thank you. I'm wondering if your future plans include harnessing the participation of your members to get additional evaluative data about what has worked for them in some of the lifestyle programs that you're offering. So, for example, with those women who would have prediabetes, and if you had a way of segmenting your population, who had success with Weight Watchers, who had success with Curves, or versus a DPP, and a diabetes prevention program, and I'm just curious what evaluation potential there is to inform us in other programs.
Well, that is such an excellent segue into one of the next sort of groundbreaking things, at least my understanding for this division in this department, is that we are just finishing up, writing up an economic evaluation with Allie Johnson's help and guidance and steering the ship. And so we have finished, and we're in the middle of trying to present and probably publish about what makes more sense economically, sending women to Weight Watchers or sending women to Curves Complete. And so that's been a real eye-opener as well, I think, just dollar for dollar of what we spend and how we spend. So we've been doing that. We may this summer start a little, we also give women blood pressure cuffs to take home. So there's a whole self-monitored blood pressure program. And I think we're going to have a summer intern do a survey of those members to try and understand what are they doing with that blood pressure cuff. Are they just taking it? Are they calling their doctor and reporting the data? Are they just using it for themselves? Is it sitting on the shelf? Is their husband using it? All of those things that, when we have time, we survey our members all the time. In fact, we're a little nervous about survey fatigue, but they really seem to be, we ask them, what fruits and vegetables did you prepare after last summer's coupons? How did you use your CFA share? What was your best aha moment? And that's what I mean about the nature of this program, is that we are really entwined in these women's lives in this really incredible way. It's really, like, I'm proud. But I could. Yes, no.
I know that household income information, but did you have any kind of employment status for, not necessarily for searching, but when women actually enrolled? Was there any kind of idea if they're unemployed, if they're employed in certain occupations?
Do you mean for the targets or for
the people
collect?
The women that were actually, that you actually worked with, the ones that you did profiles on, did you have any kind of information on their occupation status?
What we collect from women is pretty minimal, in fact. The eligibility for the program is about their income, and it's about their citizenship sometimes, and it's about whether they live in Vermont and they meet the age range. Okay. And so we really don't on purpose. Right. Because that, no surprise, is a barrier to people wanting to fill out your form. It's like, no, I'm not. So I know that we need their income data in order to be eligible for the program. And other than that, I mean, Siobhan and Carrie may know from having conversations with them, but that's not part of their profile for us.
But that's household income, right? So it's not necessarily their personal.
It's household. For our target, it was Facebook, that was and they're gonna perfectly line up, you know, because you're trying to capture maybe a little more, you want a little bit broader of an audience, make sure that the people right on the edge about the application, if it's household income, but.
It is, yeah.
Okay.
Yeah. Thanks for coming.
Yeah, thank you so much.